Signs and symptoms of liver cancer. Did you know liver cancer is one of the fastest growing cancers in the world? Yet many people miss the warning signs until it's too late. Liver cancer is the sixth most common cancer globally and a leading cause of cancer-related deaths. According to the World Health Organization, it claims over 800,000 lives every year. That's a shocking number, but early detection can make a big difference. So what are the signs and symptoms of liver cancer that you need to watch out for? From unexpected weight loss and fatigue to abdominal pain and jaundice, understanding these signals could save your life or the life of someone you love. In today's video, we'll break down the key symptoms you should never ignore, along with practical insights to help you stay informed. Let's dive in and talk about what you need to know to catch liver cancer early. Hepatocellular carcinoma, or HCC, is the primary form of liver cancer. Primary means the cancer starts in the liver rather than spreading from another part of the body. HCC is an aggressive cancer that most often develops in people with advanced liver disease, such as cirrhosis. It's also increasingly linked to metabolic dysfunction-associated steatotic liver disease, or MASLD, a condition that can sometimes lead to cirrhosis. In its early stages, HCC grows slowly, and treatments like surgery to remove the tumor or a liver transplant can be effective. However, the challenge lies in its detection. Most people don't realize they have HCC until it reaches an advanced stage and begins spreading rapidly. At this point, the cancer can lead to liver failure and becomes far more difficult to treat. HCC is responsible for about 85% to 90% of all primary liver cancers, meaning it originates in the liver rather than spreading from another part of the body. Statistically, HCC is 2 to 3 times more common in men and individuals assigned male at birth, AMAB, with most diagnoses occurring in people aged 60 or older. Given how serious HCC is, regular monitoring is crucial for people at high risk, especially those with cirrhosis or MASLD. Early detection can make a significant difference in treatment outcomes, offering a better chance of managing the disease and improving survival. If you're at risk, consulting your healthcare provider for regular screenings is essential. Now let's discuss the signs and symptoms of liver cancer that you need to watch out for. First is unexplained weight loss and loss of appetite. One of the earliest signs of liver cancer is unintended weight loss without changes in diet or physical activity. Alongside this, many people experience a significant loss of appetite, feeling disinterested in food. This happens because liver cancer affects how the liver processes nutrients, leading to metabolic disruptions. The body may start breaking down muscle and fat, causing noticeable weight changes. Combined, these symptoms can leave you feeling weak and fatigued. While weight loss and appetite changes can happen for other reasons, if they persist, it's crucial to see a doctor for further evaluation. The second symptom is abdominal pain and fullness. Liver cancer often causes pain or discomfort in the abdomen, particularly on the right side under the ribs. Some people feel this pain radiating to the right shoulder blade, a telltale sign of liver issues. Additionally, the liver can become enlarged, leading to a sensation of fullness or a lump under the ribs on the right side. If the spleen enlarges, often a result of liver dysfunction, you may feel fullness under the ribs on the left side. Abdominal pain combined with these symptoms could point to underlying liver damage or cancer and should never be ignored. Third, we have nausea, vomiting, and early fullness. Liver cancer can cause nausea and vomiting, often linked to disrupted liver function and a buildup of toxins in the body. Many people also report feeling full very quickly, even after eating small meals. This occurs because an enlarged liver or fluid buildup in the abdomen can compress the stomach, reducing its capacity. These symptoms can significantly affect your quality of life and nutrition, contributing to weakness and weight loss. While nausea and early fullness are common with other conditions like gastritis, their persistence combined with other signs should prompt a medical evaluation. Next is swelling or fluid buildup in the abdomen. A common symptom of advanced liver cancer is abdominal swelling or fluid buildup, known as ascites. This happens when the liver's ability to regulate blood flow and protein production is impaired, causing fluid to leak into the abdominal cavity. Ascites can lead to a noticeable increase in belly size, discomfort, and pressure. It may also make breathing difficult if the fluid compresses the lungs. You might notice enlarged veins on the surface of the belly due to increased pressure. If you experience significant swelling or fluid retention, it's critical to seek medical care immediately. The fifth symptom is jaundice and itching. Jaundice, or yellowing of the skin and eyes, is a common symptom of liver cancer. It occurs when the liver can no longer process bilirubin, which is a yellow pigment from red blood cells, leading to its buildup in the blood. This yellowing often coincides with itching caused by bile salts accumulating in the skin. Jaundice can also cause dark urine and pale-colored stools. These symptoms indicate severe liver dysfunction, which could be due to cancer or other liver diseases. If you notice yellowing of the skin, persistent itching, or changes in urine or stool color, seek medical attention promptly. Finally, we have unusual bruising, bleeding, and fever. Liver cancer can impair the liver's ability to produce clotting factors, leading to abnormal bruising and bleeding, even from minor injuries. For example, you may notice bruises appearing more easily or gums bleeding excessively. Some individuals also experience unexplained fevers, often caused by inflammation or infection due to weakened liver function. These symptoms point to a compromised liver, which may result from cancer progression. Enlarged veins on the abdomen may also appear, indicating increased pressure in blood vessels. Abnormal bruising, persistent fever, or visible veins should be taken seriously and addressed by a doctor. Another important aspect to consider is the effect of hormones produced by some liver tumors, which can impact organs outside the liver. These hormones can trigger various conditions that lead to unexpected symptoms in the body. One such condition is hypercalcemia, or high blood calcium levels, which may cause nausea, confusion, constipation, weakness, or muscle problems. This happens when the tumor releases substances that increase calcium levels in the bloodstream. On the other hand, some tumors cause hypoglycemia, or low blood sugar, leading to fatigue, weakness, dizziness, or fainting. This occurs because the tumor interferes with blood sugar regulation, draining energy levels. In men, liver tumors may cause unusual symptoms such as breast enlargement or gynecomastia, and/or testicular shrinkage. These changes occur when liver tumors release hormones that mimic estrogen, causing hormonal imbalances in the body. Another effect is erythrocytosis, a condition where the red blood cell count becomes abnormally high, making someone appear red or flushed. This happens when liver tumors stimulate the production of erythropoietin, a hormone that increases red blood cell production. Lastly, liver tumors may elevate cholesterol levels as they disrupt the liver's normal function of processing and regulating cholesterol in the body. While these symptoms may not immediately point to liver cancer, their persistence or unusual nature should not be overlooked. If you or someone you know experiences any of these symptoms alongside other warning signs, it's essential to consult a doctor for proper evaluation and timely diagnosis. Lastly, let's explore the causes and prevention of liver cancer. Liver cancer occurs when liver cells develop DNA mutations, leading to abnormal cell growth and the formation of tumors. These mutations can be triggered by chronic infections with hepatitis B or C, cirrhosis, or inherited liver diseases such as hemochromatosis and Wilson's disease. Other risk factors include diabetes, non-alcoholic fatty liver disease, and exposure to aflatoxins, which are toxins from mold-contaminated grains and nuts. Long-term excessive alcohol consumption can also damage the liver, increasing the risk of liver cancer. Prevention involves reducing the risk of cirrhosis by drinking alcohol in moderation, with women limiting intake to 1 drink per day and men to 2 drinks. Maintaining a healthy weight through a balanced diet and regular exercise is also essential. If weight loss is needed, aim for a gradual loss of 1 to 2 pounds per week. These steps can significantly reduce the risk of liver cancer. Thank you for watching. I hope this video has provided valuable insights into liver cancer, its causes, symptoms, and ways to reduce the risk. Remember, early detection and prevention are key to maintaining liver health. Don't forget to like, share, and subscribe for more health-related content. And as always, if you have any questions or thoughts, feel free to leave them in the comments below. Stay informed, stay healthy, and I'll see you in the next video.